potential implications of quercetin in autoimmune diseases. In dietary supplement, daily doses of quercetin are usually in the range of 1 to 250 milligrams. After ingestion, quercetin can combine with salivary proteins to form soluble protein quercetin binary aggregates. Approximately 60% to 81% of quercetin is channeled to the liver via the epithelium, where it is metabolized and converted into a bioavailable form. Most quercetin and its metabolites are excreted via the intestines, but small amounts are excreted by the kidneys and the urine. Recent studies suggest that gut microbiota participate in the production of glycosidases and enzymes that convert quercetin into more readily absorbable molecules. Quercetin can evidently be metabolized as glucuronidated, methylated, and sulfated derivatives, such as acid. Quercetin reportedly exerts powerful anti-inflammatory effects, mainly via inhibition of cytokine production. We've already been through this in past videos. The excellent antioxidant activity of quercetin is mainly exerted via effects on the activity of glutathione enzymes and reactive oxygen species. We've been through this before. It activates NRF2, and it also helps to activate other endogenous antioxidants. And also quercetin itself is an antioxidant. Quercetin has undergone clinical trials, and to date, no significant toxicity or side effects have been observed. Quercetin has undergone clinical trials, and to date, no significant toxicity or side effects have been observed in humans. Inhibitory effects of quercetin on inflammation have been observed in clinical trials, or in clinical studies, I should say, as it has the capacity to suppress multiple types of cancer. It has the capacity to suppress multiple types of cancer, which will be covered in my later series, which I will be doing on quercetin versus Alzheimer's disease and various cancers. Rheumatoid arthritis. Okay, and that's so let's see what quercetin does with this. So quercetin significantly alleviated morning stiffness and pain in rheumatoid arthritis patients in that study, blah, 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 blah. In another study, in a murine arthritis model, quercetin treatment reduced release of inhibited, blah, blah, blah. Okay, found that quercetin attenuated collagen-induced arthritis by regulating this pathway here. Okay, the apparent migration, proliferation, and invasion of fibroblast life, blah, 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 are considered to be a major part of the edited pathogenesis in vitro. Quercetin significantly in vitro, not in vivo, so not in the body, but in a test tube. It did significantly inhibit the migration and invasion of these fibroblast type things. So many studies indicate that quercetin can inhibit the generation of osteoclast-like cells, bone resorption, depression, bone marrow macrophages. Okay, RA affects extra-articular tissues or organs, including blood vessels, the nervous and gastrointestinal systems, heart, lung, and kidneys. Okay, treatment with quercetin alone. Reverse the aforementioned neurodegenerative effects. Treatment with quercetin alone reversed the neurodegenerative effects to an extent, possibly due to its anti-inflammatory and antioxidant and antiarthritic and neuroprotective capacities. Inflammatory bowel disease. Quercetin has been shown to be a potent anti-inflammatory component. Oral quercetin has not exhibited the desired effects in colitis. This could be partly because it is absorbed in the upper gastrointestinal tract and thus does not reach the lower gastrointestinal tract. Although rutin may have unless the flavonoid is introduced in its glycosated form, the most common of which is the compound rutin. Rutin you can buy also. You can buy straight rutin. Only approximately 10% of the orally ingested rutin is generally able to pass epithelial cells. The rest is converted to sulfated and glucose. By the gut generate quercetin. Although rutin may have direct effects in the treatment of irritable bowel disease, it is reasonable to surmise that its pharmacological activity and effects are exerted via conversion to the bioactive glycone quercetin. Rutin is hydrolyzed by the gut bacteria in the colon to synthesize quercetin. So rutin is then turned into quercetin. So it may act as a prodrug, with quercetin being the active component. Rutin has been shown to have potent effects in vivo, meaning in the body. Okay, rutin is another form of quercetin that is turned into quercetin. It's turned back into quercetin by the gut bacteria. Okay, quercetin could ameliorate DSS. What's DSS? Some evidence suggests that glycosylation of quercetin, as demonstrated by rutin, is an important structural feature of flavonoids with respect to their efficacy against irritable bowel disorder or irritable bowel disease. Quercetin and its glycosides, which are common in the blood in conjugated products, need be designed such that post-absorption they release active quercetin with a specific pattern in the colon. Several experiments of formulations have been conducted in recent years to address this problem and enhance the pharmacological efficacy of quercetin. The oral administration of quercetin-loaded microcapsules generated with a pectin and casein polymer attenuated macroscopic damage and edema, reduced neutrophil recruitment. You could also just take it with fat to help it absorb better. Overall available evidence suggests the efficacy of orally ingested glycosated form of quercetin, such as rutin or quercetin delivered via drug carriers for IBS, blah, blah, blah. Quercetin is one of the most abundant natural flavonoids and has promising therapeutic potential for IBD. Multiple sclerosis, this is an important one, is an autoimmune inflammatory disease of the central nervous system. Okay? Causes neuroglial activation, blah, 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 blah. Let's see what it says here. Quercetin has been associated with reductions in the release of tryptase and inhibition of histidine mRNA from human mast cells. Quercetin may be useful in the complementary treatment of multiple sclerosis. I highly, highly, highly recommend that people read the Walls Protocol. Other autoimmune diseases. Quercetin attenuated the symptoms of lupus in a systemic lupus of the mouse model. Graves' disease. Quercetin can reportedly inhibit DNA damage by modulating oxidative stress in lymphocytes from Graves' disease. Atopic dermatitis is an autoimmune and inflammatory skin disease characterized by skin lesions exhibiting infiltration by mast cells, ionocyte macrophages in the mouse model. Okay. Conclusion, autoimmune diseases are systemic conditions that are difficult to cure, and patients often require long-term treatment. The development and pathogenesis of autoimmune diseases involve multiple associations and interacting factors. The diversity and complexity of associations between the components involved are likely to limit effects of therapies and contribute to adverse side effects. Quercetin possesses anti-inflammatory, antioxidant, neuroprotective, and anti-allergic or anti-allergenic activities, as well as the capacity to interact with multiple molecules and targets. Moreover, treatments involving appreciable doses of quercetin have evidently been low toxic or non-toxic. quercetin will be expected to become a potential opportunity and supplement for the treatment and prevention of autoimmune diseases. Quercetin will be expected to become a potential opportunity and supplement for the treatment and prevention of autoimmune diseases. However, it is particularly important, since there is no evidence so far that quercetin could reduce the morbidity and mortality of autoimmune diseases. The direct effects of quercetin on immune imbalance in patients are still unconfirmed, blah, 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 blah. Okay. And I'm going to move on. Quercetin versus metabolic syndrome. Quercetin supplementation alters adipose and hepatic transcriptomes and ameliorates body fat and imbalanced blood lipids, meaning blood fats, and glucose intolerance in male rats. And this is important to understand, particularly because a lot of psychiatric drugs cause metabolic disease, cause high body fat, cause dyslipidemia, cause glucose intolerance, and if you're coming off the junk, you need something that reverses the problem. So in conclusion, quercetin supplementation improves abnormalities related to metabolic syndrome, namely body fat and imbalance, which is dyslipidemia, imbalanced blood fats, and glucose intolerance. And these are all caused by psychiatric medications. Now, metabolic syndrome, which is regularly caused by psychiatric drugs, is a combination of cardiometabolic abnormalities such as central obesity, meaning obesity in the abdomen, hypertension, and glucose intolerance, as well as dyslipidemia, correlated with an increased risk of type 2 diabetes, cardiovascular disease, and all-cause mortality. Quercetin, found naturally in numerous fruits and vegetables, is one of the most abundant flavonoids in the human diet. Extensive evidence has demonstrated its favorable impact on human health, including various features, blah, blah, blah. Even though the exact idiopathic individuals with increased visceral fat deposition also typically evince insulin resistance, meaning they have insulin resistance, and hyperinsulinemia, meaning they have too much insulin, resulting in impaired glucose tolerance, meaning their body doesn't handle sugar well. In this study, they detected a significant decrease in fasting insulin levels along with lower postprandial blood glucose. The oral glucose tolerance test, blah, 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 Atherogenic dyslipidemia, namely high triglycerides and low HDL cholesterol levels, is an integral component of metabolic syndrome. Although quercetin seems to have a favorable effect towards normalizing blood lipid levels, the results are not consistent. Many studies report very little or no improvement in lipid levels after quercetin administration. In this study, they detected no significant changes in total cholesterol and free fatty acids. However, the level of triglycerides greatly decreased in the serum, as well as in the liver of the rats. So it helps with the liver health, and it reduced the fats in the serum. Some other studies also support these findings, confirming the ability of quercetin to decrease triglyceride levels while total cholesterol levels remain unchanged. Now remember, part of your total cholesterol is HDL, which you would prefer to have rather high. One of the most quercetin downregulated genes in the liver is Tsukushi. It was identified, blah, 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 There is ample evidence for the involvement of microRNAs in both pathogenesis and metabolic syndrome and favorable. Now remember, quercetin is an epigenetic adaptogen, and RNA is what is being affected with the epigenome, so it would make sense that microRNAs play a role in the pathogenesis of metabolic syndrome, and that quercetin and other polyphenols downregulate these things. Okay, quercetin in the adipose tissue, meaning the fat tissue, blah, blah, blah. Okay, conclusion. Individual features of metabolic syndrome such as body fat, blood sugar problems, and high blood fats, meaning high cholesterol level in rats, can be ameliorated. It can be fixed by quercetin. And they present a crucial transcriptomatic nodes, blah, 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 data availability, yada, 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 and moving on. Protective effect of quercetin against the metabolic dysfunction of glucose and lipids and its associated learning and memory impairments. Quercetin is methods results compared to let's go to the conclusions. These results suggested the therapeutic potential of quercetin against non-alcoholic fatty liver disease associated with impairment of learning and memory, and the mechanism might involve regulating the metabolic dysfunction of glucose and lipids and balancing protein expression of synaptic plasticity. Non-alcoholic fatty liver disease is a chronic liver injury, yada yada yada. And I'm going to move on. You can read this on your own if you'd like. The influence of quercetin on recognition, memory, and brain oxidative damage in a ketamine-induced model of schizophrenia. Okay, now what I want you to understand, you can read this on your own, but keep in mind they're exploring ketamine as a psychiatric drug, where in the laboratory it's literally used to induce this stuff. So conclusion, these results show that quercetin has the potential to improve cognitive deficits in mice, and that quercetin may be useful for treating symptoms of schizophrenia, partially due to its ability to scavenge free radicals. A reversal of oxidative stress and cytokine toxicity and DNA fragmentation by quercetin in induced animal model of schizophrenia. So keep in mind, you can induce schizophrenia with poisons in the laboratory. Quercetin is a polyphenolic, yada yada. Schizophrenia is one of the neuropsychiatric disorders in human beings with rapid mortality and intense morbidity, which can be treated with antipsychotics, but these commercial drugs exert adverse effects and have less efficacy to treat the full spectrum. So they don't really work, is the problem. Okay, so let's see here. Quercetin was administered, yada, 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 neurochemical inflammation, The present findings revealed that quercetin significantly reverses the effects of this chemical-induced psychosis-like symptoms in all behavioral assessments. This flavonoid also regulates dopaminergic, serotonergic, and glutamatergic neurotransmission, a profound effect on inflammatory, and it has a profound effect on inflammatory cytokines and reduced DNA fragmentation. The findings suggest that quercetin can be considered as a preventative as well as a therapeutic to attenuate oxidative stress and cytokine toxicity, regulate neurotransmission, and prevent enhanced DNA fragmentation that can lead to the amelioration of psychosis-like symptoms of schizophrenia. So keep that in mind. The findings suggest that quercetin can be considered a preventative and a therapeutic to attenuate oxidative stress, cytokine toxicity, regulate neurotransmission, and prevent enhanced DNA fragmentation that can lead to the amelioration of psychosis-like symptoms. One more time, just in case you weren't paying attention. The findings suggest that quercetin can be considered a preventative and a therapeutic, okay, and that it can attenuate oxidative stress, cytokine toxicity, regulate neurotransmission, prevent enhanced DNA fragmentation that can lead to the amelioration. It can stop the psychosis symptoms of schizophrenia. The antidepressant potential of quercetin. Promotion of cell regeneration in the hippocampus, the regeneration of The regeneration hypothesis comprehends another view of depression pathogenesis and is supported by increasing evidence. For example, X-ray irradiated mice present depressive-like symptoms due to neurogenesis disorders that cannot be improved by antidepressants. So keep this in mind. The depressive symptoms that are caused by irradiating the mice, okay? And remember, other things act similarly to radiation, such as vitamin K deficiency. If you look into Bruce Ames's research, it shows that not getting enough vitamin K will cause double-strand breaks, just like being irradiated. But it can't be fixed with antidepressants. However, it seems like it can be fixed with quercetin. So quercetin on neurogenesis, they found that quercetin promoted the proliferation and differentiation of neural stem cells in adult rats with Alzheimer's disease. Blah, blah, blah. Besides the fact that quercetin could directly increase the number of hippocampal neurons and glial cells, the regulation of brain-derived neurotrophic factor by quercetin can indirectly promote neurogenesis. BDNF is a neurotrophic factor that binds to its high-affinity receptor, tyrosine kinase receptor B, to promote the survival, proliferation, and maturation of adult olfactory bulb and dentate gyrus neural progenitor cells. Okay? Quercetin can alleviate depressive behaviors induced by lipopolysaccharide in rats by increasing the levels of that BDNF, okay, in the hippocampus and prefrontal cortex. Improvement of hypothalamic and pituitary adrenal axis, okay. Quercetin can exert antidepressant effects by inhibiting hyperactivity of hippocampal, adrenal axis, blah, blah, blah. Quercetin could alleviate the doxorubicin-induced anxiety like depression behavior in mice and after adrenaline intervention. Okay. Reduction of inflammation. We know that it's an anti-inflammatory that reduces cytokines. Antioxidation. We know that it's an antioxidant and it plays into its ability to alleviate depression. Okay, research on antidepressants. Okay, quercetin mainly exists in the form of, Isoquercetin is a quercetin derivative. Another study showed that isoquercetin, either in monotherapy by itself or in combination with estrogen, could significantly improve oxidative stress, pro-inflammatory cytokines, and brain monoamine concentration. So by itself, or with estrogen, but by itself, it can improve these things. Rutin. In recent years, several studies have demonstrated the antidepressant effects of rutin. Okay, rutin can also increase the diameter, blah, 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 region in the hippocampus, so it's increasing the size of the hippocampus. Another experiment demonstrated the slow onset of rutin by finding the plasma levels of quercetin metabolites were low in rats after taking 20 milligrams of rutin powder. Quercetin 4, whatever, is the main quercetin in onions. The antidepressant effects of onion powder, just onion powder, have been proved. The antidepressant effects of onion powder, have been proved for a long time. Okay, however, quercetin glucoside was not regarded as a main component responsible for the antidepressant effects of onions until 2021. Okay, it found that quercetin glucoside could reduce depressive-like symptoms in mice. Avacolarian, also known as quercetin 3, is a flavonoid and quercetin derivative compared with quercetin, blah, 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 has a stronger anti-inflammatory ability. The excessive secretion of cytokines, blah, 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 blah. Okay, they also found the activation of and the hippocampus was inhibited, and tumor necrosis factor reduced. Discussion. Due to the I can't read that because that'll get my video taken down. Quercetin and its derivatives generate quinone metabolites via tyrosinase in vitro, blah, blah, blah. Let's see here. Moreover, the current studies still have in a blah, blah, blah. Overall, the antidepressant effects of quercetin and its glycoside derivatives have been demonstrated by a large number of studies. The antidepressant effects of quercetin, a natural chemical that has not been shown to have side effects, has been demonstrated by large numbers of studies, and the related mechanisms have been continuously explored. After improving the studies regarding relevant mechanisms and safety, drugs based on quercetin and its glycoside derivatives can become the main components during depression treatment. Moving forward. Quercetin prevents alterations of behavior parameters, delta blah 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 blah, in rats and prenatal model of autism. Okay, autism is a neuropathology characterized by behavioral disorders. Considering that oxidative stress is involved in the pathophysiology of this disease, we evaluated the effects of quercetin, a flavonoid with antioxidant and neuroprotective properties, in the experimental model of autism induced by valproic acid. So keep this in mind. This is Depakote, and it causes autism. 12 pregnant female, blah, 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 behavioral test, cerebral cortex, hippocampus. Our findings demonstrated that quercetin has neuroprotective effects in an animal model of autism. Quercetin has neuroprotective effects in an animal model of autism, suggesting that this natural molecule could be an important therapeutic agent for the treatment of autism spectrum disorders. So I hear it now. Is quercetin safe for use in children? Quercetin is a plant pigment. This is from naturopathypediatrics.com. Quercetin is a plant pigment. Quercetin is commonly used for preventing histamine-mediated allergic symptoms. Quercetin prevents the excessive release of histamine by inhibiting mast cells. Quercetin is also used to prevent and treat viral infections, protect cells from drug-induced tissue damage, support cognition and brain health, inhibit cancer cell growth, and combat chronic inflammation. In fact, quercetin is one of the most commonly used bioflavonoids for individuals with metabolic and/or inflammatory disorders. Documented benefits of quercetin include cardiovascular. These are the documented benefits. They include cardiovascular protection, anti-cancer, anti-tumor, anti-ulcer, anti-allergy, antiviral, anti-inflammatory, anti-diabetic, gastroprotective, anti-hypertensive, immunomodulatory, and anti-infective effects. Quercetin can be found in onions, shallots, broccoli, apples, cherries, berries, red grapes, green tea, tomatoes, kale, Brussels sprouts, cabbage, citrus fruits, almonds, pistachios, buckwheat, olive oil. It's important to note that quercetin is primarily found in the peel or outer layer of these foods, so be sure to leave the peels on when possible. Quercetin is a lipophilic compound, which means it's absorbed in the presence of dietary fat. Consider adding olive oil, avocado, or nuts and seeds to any of the foods listed above. Quercetin supplements versus food source. The doses of quercetin typically used in clinical studies is 500 to 1,000 milligrams per day. However, most people will only consume a small fraction of that amount in food. Quercetin dose. The most commonly used quercetin dose is 500 to 1,000 milligrams per day. However, clinical studies are conducted almost exclusively on adults. Generally, children are prescribed 25 to 50% of the adult dose. possible side effects. Documented side effects of quercetin include headache, numbness, and tingling. In research studies where quercetin is given intravenously, other side effects include shortness of breath. Now that's an intravenous, that's given intravenously. Shortness of breath, nausea, vomiting, and kidney damage, where it's given intravenously, not orally. Quercetin should not be administered intravenously unless under the supervision of a board-certified naturopathic oncology specialist for a blah, blah, blah. Quercetin medication interactions, like many bioflavonoids, blah, 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 can interfere with the clearance of different medications. Quercetin is also suspected to have some MAOA and blah, blah, blah inhibition, though not proven. This person strongly suggests avoiding quercetin administration in adults and children who are taking an MAOI medication. Luckily, they're not prescribed too much anymore because of their side effects. Is quercetin safe for use in children? Safety studies for quercetin in children are lacking. However, robust clinical trials for quercetin use in adults have been completed, and no significant side effects or toxicity have been observed, with the exception of intravenous quercetin use in cancer patients. Studies in adults show that quercetin is probably safe when used in doses of 1,000 milligrams for 12 weeks. Because quercetin is a potent bioflavonoid, most research shows anti-cancer, neuroprotective, anti-inflammatory, and other positive benefits. It is highly unlikely that effects in children would be dramatically different from those in adults. Quercetin is possibly unsafe in patients taking medications that are affected by the above listed medication interactions. Okay, moving forward. Quercetin mitigates amphetamine-induced anxiety-like behavior through ameliorating mitochondrial dysfunction and neuroinflammation. In the present study, they found the mitochondrial morphological defects accompanied the dysfunction of MA-treated mice, methamphetamine-treated mice with anxiety-like behavior. Quercetin attenuates anxious symptoms and pathology and modified mitochondrial and neuroinflammation in both a mouse model and cultured astrocytes treated with methamphetamine. These findings for the first time suggest that quercetin could inhibit the progression of methamphetamine-induced anxiety by modulating mitochondrial function and morphology and mitigating neuroinflammation in the central nervous system. The results indicated that quercetin represents a potential therapeutic medicine for future development and supported hypothesis that changes in mitochondrial function-mediated anxiety progression. They found that methamphetamine-induced anxiety-like behavior in mice, as previously described, consisted of Accumulating data has highlighted the contributions of brain mitochondria and bioenergetics to the development of psychiatric disorders. Accumulating data has highlighted the contributions of brain mitochondria and bioenergetics to the development of psychiatric disorders and stress-related pathologies. The damaged mitochondria accumulation induced synaptic loss and neuron apoptosis, underscoring the importance of mitochondria in the development of psychotic disorders. In addition, the fundamental role played by mitochondria in the synthesis of primary excitatory neurotransmitter glutamate and the inhibitory neurotransmitter amabutyric acid, or GABA, suggests that mitochondrial adaptations observed in the context of anxiety may contribute to an imbalance in neuroexcitation and inhibition. Mitochondria-targeted drugs have been reported to show good outcomes in anxiety-related studies in both humans and rodents. In this article, they further demonstrated that modification of mitochondrial function and morphology might represent a potential strategy. In case you're wondering, don't do crank. It will prematurely age you because it screws up your mitochondria. For alleviating anxiety-like behaviors induced by methamphetamines, since chronic methamphetamine exposure resulted in dysregulation of mitochondrial morphology. Quercetin is a bioactive component with diverse pharmacological effects, has been reported to exert several beneficial effects, including neuroprotective effects, the regulation of sleep-wake cycles, and optimization of mitochondrial function. In this study, quercetin supplementation significantly mitigated methamphetamine-induced anxiety-like behavior by improving mitochondrial morphology and function, alleviating neuronal injury both in vivo and in vitro. Okay, moving on. Natural polyphenols, resveratrol, quercetin, magnolol, and beta-catechin block certain aspects of heroin addiction. Interesting, huh? How come you're not told about this in rehab by your psychiatrist? Quercetin and beta-catechin, or catechin, are associated with significantly lower withdrawal scores compared to naloxone precipitated withdrawal. Blah, blah, blah. Resveratrol worsens induced with heroin withdrawal, blah, blah, blah. Let's skip to the conclusion here. Molecular effects. Resveratrol attenuated the heroin. So resveratrol and magnolol attenuated the heroin-induced increase, blah, blah, blah. Quercetin abolishes heroin dependence acquisition and inhibited reinstatement attributed to anti-inflammatory effects. So their results are in accordance with those, blah, blah, blah. Okay. So it seems that quercetin abolishes heroin dependence. Okay. So interestingly, quercetin prevented certain aspects of naloxone precipitated heroin withdrawal. Beta-catechin blocked reinstatement but not acquisition of heroin dependence. So you should use a bunch of different polyphenols, most likely. Could polyphenols act through blah, blah, blah? Could the current results be related to the anti-inflammatory mechanism? Now, you guys can read this on your own if you want. It'll be linked in the description. The role of immunomodulatory mechanisms. Heroin and other exogenous opiates exert neuromodulatory effects through both immune suppression, so they suppress the immune system, and activation depending on the stage of drug use. Okay, the effects of individual polyphenols on the immune system are complex. For example, resveratrol modulates the immune response with both anti-inflammatory and immune-enhancing effects, possibly in dose-dependent manner. Of course, it's in a dose-dependent manner. On the other hand, resveratrol enhanced immunity recovery, blah, blah, blah. Quercetin also exhibits immunomodulatory activities through inhibiting the secretion of inflammatory cytokines. Quercetin significantly inhibited the production of blah, 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 blah. Beta-catechin is a natural immune enhancer present in several plants such as green tea leaves, black grapes, and cherries. Clinical data relative to the use of these compounds in drug use and dependence is not present. However, quercetin, resveratrol, and catechin were investigated clinically in many other disorders such as diabetes, cancer, arthritis, and neurodegenerative diseases, while magnolol was investigated in dental and periodontal studies. Okay, and that's available at clinicaltrials.gov. So, yeah, that's all for this. Wait, I'm moving on. Quercetin, a bioflavonoid, reverses development of tolerance and dependence to morphine. Quercetin in treating alcohol withdrawal-induced anxiety and convulsions. chronic administration of ethanol, blah, 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 blah. Ethanol withdrawal also induced a significant increase in the locomotor activity of mice. Daily administration of quercetin, 25 to 50 milligrams per kilogram prior to ethanol for 6 days prevented withdrawal-induced locomotor activity. So they gave it prior to the administration of the alcohol. Ethanol withdrawal was also sensitized to convulsogenic, meaning it caused convulsions like seizures. A non-convulsive dose was higher, 40 to 60 milligrams per kilogram. Both acute and chronic administration of quercetin produced a significant protection against ethanol-induced reduction in blah, 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 threshold in mice. The results suggested a protective effect of this safe drug quercetin in the management of ethanol, meaning alcohol withdrawal. The result suggests a protective effect of this drug quercetin, this safe drug quercetin, in the management of ethanol withdrawal reactions. It shows a protective effect of quercetin in the management of ethanol withdrawal reactions. And that's all for this video in this video series.